So today we'll be talking all about how to prevent HIV after getting exposed. So the medication we use is what we call post-exposure prophylaxis. And for this video, I'm going to call it PEP. So the word prophylaxis means to prevent or control the spread of an infection or a disease. So with PEP, it means taking the HIV medication within 72 hours or 3 days after being exposed to HIV to prevent the HIV itself. It's important to know that PEP should only be used as an emergency medication, and it's not meant for regular use by people who are exposed to HIV frequently. And it's not intended to be used to replace regular use of other HIV prevention methods such as wearing a condom all the time, during sex, or even taking PrEP, what we call pre-exposure prophylaxis. This is different from PEP in that people that are at risk for HIV take a specific HIV medication daily or an injection every 2 months to prevent from getting HIV. PEP may be prescribed for people who are HIV negative or do not know their HIV status, and in the last 3 days they may be exposed to HIV during sex, sharing needles or other equipments like injection drugs, and they got a needle stick, they were sexually assaulted, or they may be exposed to HIV at work due to occupational exposure. So if you think any of this happened to you, go to your doctor immediately so you can start these medication. These medication must be started within 72 hours or 3 days after the possible exposure. The sooner you start it, the better, because every hour counts. So what the PEP does is stop the HIV virus from replicating, or what we call multiplying. So when these medications combine, they try to prevent it from spreading all over your body. And it's important to note that it's very effective if you start it as soon as possible. And research has shown that PEP reduces getting the HIV infection greater than 80% of the times. With these medications, you'll need to take them every day for 28 days. And some persons may complain of some symptoms that they're having, that they can have nausea, upset stomach, fatigue, and headaches, and they just don't feel good. It's important to know that these symptoms usually go away within the first week of taking them, and to prevent the nausea, you can take PEP with a snack or before bed to make the nausea less noticeable. And to relieve the nausea, you can even try other things like a ginger candy or peppermint tea. And remember, always try to do your part in limiting the stigma for HIV/AIDS worldwide. Even though HIV has no cure, it's not a death sentence, because there are medications to make you undetectable if you do have HIV. And undetectable means you cannot, or there's a very low chance of spreading the virus to your partner.